Am I audible as well as visible? Let me know. Let me check and then we'll continue. Am I audible? Am I audible properly? Let me. Hello, students. Welcome to Unacademy Future Doctors. Kaushik. Hello. Welcome to Unacademy Future Doctors. I myself, Dr. Dipti Kariya, I am MD PhD Physiology. I am Associate Professor and Education MBBS and MD student. I have more than 17 years of teaching. Now, let me explain within 2 minutes about our subscription. Here we have two subscription patterns. One that is plus subscription and second one that is iconic subscription. Okay? So here starting with the plus subscription. In plus subscription, choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. Tim, hello. You can access question bank having more than 25,000 questions. You can compete in the live test as well as, and within 12 months we are coming with our printed note. Next subscription, that is iconic subscription. Here your access to the best from two of the best. Which are these two? One that is Unacademy and Prep Ladder with Unacademy. Here all the features I have already discussed. We have well-structured live batches, recorded classes, which covers your full syllabus, question bank, which is having more than 25,000 questions. You can compete in live test as well as you can have comprehensive printed as well as digital notes. Second, that is Unacademy and Prep Ladder with Prep Ladder. Here, features are you can have clinical and integrated essentials. You can have video lectures from your dream team. You can have question bank 3, that is along with system tags and much more as well as active guidance. You can have rapid revision and snapshots and treasures and 2021 notes. You can subscribe from your mobile. Either you can have plus or iconic subscription, and longer the duration of subscription, cheaper are the. You can use my promo code DIPTI10 and you can get 10% subscription. So this was about subscription. Whatever videos we are posting on this channel on Academy Future Doctors, that is free of cost. Okay, so you can access these videos free of cost. You do not require any kind of subscription, just as well as special classes also. You can download the app and you can have special classes access. Okay? Now let us come to the topic. Starting with the topic sensory receptor. Now, what do we mean by receptors? Here, receptors other name for the receptor, that is transducer. What is the meaning of transducer? Transducers, they convert different types of energies into action potential. Okay? So whatever is the energy that comes to this receptor, they convert them into action potential. They are also known as specialized type of nerve endings. You can see here, these are our nerves and their endings, just specialized and specialized for different functions. Suppose touch receptors, their structure is different, pressure, pain. So these are different specialized type of nerve. Okay? Now, these receptors, they respond to specific stimulus. Okay? Like suppose the receptor is for touch, then they respond to only touch. And what is stimulus? Stimulus means any change in the external environment. Now, classification of receptors, sometimes it may be asked as a question. So, classification is by different ways. Okay? Classification is of 5 types. One, that is according to type of stimulus. Classification is one, that is mechanoreceptor. Mechanoreceptors means these are the receptors which are stimulated by change the mechanical pressure or mechanical stimulus. Change in the mechanical uh, input. Okay, so these are mechanoreceptors. Examples are touch receptors, pressure receptors, and receptors for the vibration. Second variety, they are thermoreceptors. Thermo means temperature. So these receptors, they respond to degree of warmth. You can see here, heat and cold receptors, the thermoreceptors. Third variety of receptors are photoreceptors. These receptors, they respond to electromagnetic rays, or they are known as light rays. Example is, these are our rods and cones. They are present in the retina. Next, that is our chemoreceptors. You can see chemoreceptors, they respond to chemical change. Whenever there is change in the chemical composition, that is, suppose there is change in the oxygen consumption, oxygen concentration, change in the osmolarity, change in the glucose concentration, these chemoreceptors, they get activated. And last variety, they are nociceptor. C means painful. So they are stimulated by noxious, that is not light. Noxious stimulus stimulates this nociceptor. So this is first classification according to type of stimulus. Second classification, that is according to sensory modality. Now, what is this? According to sensory modality, that is also known as classification according to distribution of the, where are they located. Okay? One, that is spatial senses. Spatial senses means these are specialized for particular type of sensory stimulus. Okay? Like we have four important spatial senses: vision, hearing, taste, and smell. So these are spatial senses receptor or receptors for spatial senses. Second, that is cutaneous receptor. These are receptors present in the skin. You can see they are tactile receptors also. The skin as well as subcutaneous tissue. Second, third variety of receptors are deep receptors or receptors for deep senses. These receptors are located in the deep, and names of these receptors, they are muscle spindle and Golgi tendon organ, because they are receptors located in the muscles and tendons. Okay? Then visceral receptors. So these are the receptors which are present in the viscera. Okay? Now, so this is second variety of classification. First, we have discussed first one, that is according to type of stimulus. Second, that is according to sensory modality. Third, that is according to source of stimulus. This classification is also known as Sharington's classification. You can see this one, sorry, Sharington's classification. Here, according to this classification, receptors are one, that is tele receptor. Tele means they are located or they receive signal from a distant object. Examples of tele receptors, they are our vision and hearing receptors. The stimulus is away from the surface. Then second, that is extroceptors. These are the receptors, they receive information from the exterior part. And interoceptors, they're located deep, or they are also known as enteroceptors. These interoceptors, they are again of five types: baroreceptors, chemoreceptors, proprioceptors, osmoreceptors, and glucose. Baroreceptor, the name itself suggests, they respond to pressure, change in the pressure. Chemoreceptors, they respond to change in the chemical composition. Proprioceptors, they respond to uh, proprio means position of body part, or pressure also stimulates this tissue. Hello. Then osmoreceptors, they respond to osmolarity, change in the osmolarity. And glucoreceptors, they respond to change in the blood sugar level. Now, this again, this is just a broader classification that we have already discussed. Sharrington's classification according to source of stimuli. One, that is telereceptor, as I told you, vision and hearing receptors, extroceptors, receptors present on the exterior part. They are the receptors for touch, pressure, temperature, and pain. And interoceptors, which include visceroceptors, receptors present in the viscera, and these are our stretch receptors, baroreceptors, and osmoreceptors. Proprioceptors, they sense body position. They are present in the muscles, tendons, joints, ligaments. And these are muscle spindle, Golgi tendon organ, Pacinian corpuscles, and free nerve ending. Now, Next classification is depending on rate of adaptation. Now, what do you mean by adaptation? Adaptation means, suppose if we are continuously stimulating this any of the receptor continuously, when we are stimulating any receptor at a constant rate, what happens? Discharge decreases. The receptor now discharges at a slow rate. So this type of receptors are known as rapidly adapting. Adaptation means reduced response to the continuous stimulation at the same rate. You can see here rapidly adapting receptors. They are also known as phasic receptors or dynamic receptors. Rapid adaptation means when we are giving a continuous strength of stimulus, you can see the response gradually decreases. For example, suppose if you have put on specs, on the first day you feel that something is touching your skin, but after a few days you don't feel that you have put on specs. Why? Because touch receptors, they get adapted. Now they will not, or they reduce transmission of information. These are rapidly adapting. This other name is their phasic receptors. So, which are rapidly adapting? Mainly our touch receptors and pressure receptors, as well as olfactory receptors are rapidly adapting. Next one, that is slowly adapting receptors, also known as static receptors or tonic receptors. Means you can see here slow adaptation. Means suppose you are continuously stimulating with the same rate. In spite of that, there is no decrease in the rate of firing. Rate of firing will continue. So that is slow adaptation. And third variety is also here, that is no adaptation. This there is continuously firing in spite of continuous stimulation. Non-adapting receptors are receptors for pain. Slowly adapting receptors, they are our muscle spindle, which is present in the muscle. Nociceptors, nociceptor, although they are included in this for pain, they are included in non-adapting type of receptors. And cold receptors, these are tonic receptors. Okay, so this is fourth classification. Fifth one, that is clinical classification. Here, there are superficial receptors. These are the receptors present in the as well as mucous membrane. Second, that is deep receptors. These are the receptors present in the muscles, tendons, joints. They are deep receptors. And visceral receptors, they are present in the viscera. So we have completed the classification. Let us revise. We have Surendra Singh. Hello. So we have completed the classification. Let us revise. One, that is classification according to type of stimulus. First one, that is mechanothermo photoreceptor. So that is according to type of stimulus. Second classification according to sensory modality or distribution. Third classification we did, that is according to source of stimulus, which is also known as Sharington's classification. Fourth classification, that is according to rate of adaptation. And fifth one, that is clinical classification. So this is about classification of receptors. Next thing, now we discuss about different receptors. Starting with first, that is cutaneous receptor. As the name suggests, cutaneous, they are located in the skin and subcutaneous tissue. These are also known as mechanoreceptors because they respond to mechanical change, as well as these receptors. Here in cutaneous receptors, we have thermoreceptors. Receptors, they respond to change in the temperature, and receptors for pain. These all are our cutaneous receptors. So here, names of the receptors, try to remember. Cutaneous receptors. For touch, easily you can remember here, touch receptors, both they start with the word M. Measner's corpuscle and Merkel's disc. Okay, I'll show you the diagram. Pressure, for pressure, P for P, Pacinian corpuscle. For cold, trousers and organ. K for K, warmth, Ruffini and organ. Or sometimes pre-nerve endings also in some of the books they have written. And for pain, nerve endings. So these are cutaneous receptors. Okay? Now, Let us discuss one by one with diagrams. So first one, that is, you can see here, Merkel's disc and Meissner's corpuscle. Here this are the Merkel's disc. These are Meissner's corpuscle. Here, yeah. So this Merkel's disc and Meissner's corpuscles, they are tactile receptors. They respond to touch. Structure: Merkel's disc, that is expanded tip endings, and Meissner's corpuscle, they are encapsulated and they are located superficially, just immediately below the epidermis. You can see here in the upper part of epidermis. Okay, so they are located, and they are rapidly adapting type of receptor, as I told you, rapidly adapting, because something touches you, like as I told you, specs, then after few days there is adaptation of touch receptor. Okay? Then location. Now these receptors, they are located at the nerve ending. Each and every receptor has its nerve ending. Okay? Without nerve ending, there is no receptor. They are like switches. We have switches with wires. So same thing here. These are the receptors and these are the nerve endings. Okay? So these are located, which business corpuscle and Merkel's disc. They are located on the A beta nerve endings. You can see here. This is nerve ending name according to Erlanger gases classification. These are A beta nerve endings. Okay? Now, and these are located abundantly. Large amount of these receptors are present on our fingertips, also on the lips, nipple, and orifices of body. Okay? Now, second, that is Pacinian corpuscle. You can see here. These are Pacinian for pressure we have discussed. Okay, so this is Pacinian corpuscle. This one. These are also encapsulated endings. These capsules, they are like onion shape, onion pill appearance, like this. Concentric layers of lamellae are present. And these receptors are present in the skin, subcutaneous tissue, but these are present in the dermis, little bit deeper, because pressure requires this pressure is we are just feeling pressure when deep dermis receptors, they get stimulated. Okay? These are located in the skin, subcutaneous tissue, as well as in the mesentery and near tendons and joints. And these receptors are also rapidly adapting receptors. Now, next is Ruffini endogas. You can see here, these are Ruffini endogas. These are also encapsulated endings. They have also capsule and they are located in the skin, subcutaneous. They are located in the skin, but they are located in the deep dermis, and these are responsible for the warmth receptor. And these are slowly adapting type of. Okay? These are slowly adapting type of receptor. Next, Krause's and bulbs. These are Krause's. Corpuscle also they have been put on Krause's and bulbs. These are present at the mucocutaneous junction. And they are also present in the conjunctiva, lip, tongue, sheath of genitalia, and sheath of nerve. And last variety, they are naked nerve endings. Other name for them, that is free nerve endings. Okay? These are. Now, this free nerve endings, you can see, they don't have any capsule or anything, disc or nothing. They are just free naked nerve endings. And here, this endings, they are they are connected with the A delta and C fibers, unmyelinated fibers. Okay, and they are concerned with the noxious stimulus. Noxious means painful stimulus. Okay, so whenever there is painful stimulus, this free nerve endings are stimulated. Now, next is we will discuss properties of receptors. This may be asked as a question. Properties of receptors. Properties are also mainly 5 properties we will discuss. Try to remember all these properties at present now. So now, starting with first property, that is specificity of response. What is the meaning of specificity of response? Each receptor that is easily stimulated by particular, or you can say adequate or specific stimulus. Each receptor is for particular stimulus, so they are stimulated by specific stimulus. And this is also known as law of adequate stimulus. For example, Rods and cones are there for vision. An adequate stimulus for rods and cones, that is light. So when light is thrown, then rods and cones, they are stimulated easily. So you can say threshold for stimulation of rods and cones, that is least for light rays. But if suppose we are giving pressure, we are trying to stimulate rods and cones, that the threshold is higher, they cannot be easily stimulated. So light is the adequate stimulus. So this is first property, specificity of response, or it is also known as law of adequate stimulus. Second, that is adaptation, we have already discussed. In adaptation, as I told you, continuous stimulation with the same strength of stimulus. Each and every word is important. Continuous stimulation of the receptors with same strength of stimulus. So what happens initially, impulse generation rate is higher. You can see here. This is the impulse generated. Now gradually decrease. And this is known as adaptation. Now, depending on the rate of adaptation, as we have discussed, two types of receptors, phasic and tonic receptors. Phasic receptors, they are the receptors which are rapidly adapting. Okay? So here what happens, firing rate decreases fast when we are stimulating with the same strength of stimulus. Examples, as I told you, touch receptors. Let us remind which are touch receptors, Meissner's corpuscle main. And second, pressure receptors, Pacinian corpuscle. And olfactory receptors are also, you can see here, these are olfactory receptors. Bipolar cells, olfactory receptors, they are also phasic receptors. Next is tonic receptors. Tonic means these are slowly adapting. What happens here? When we are giving continuous strength of stimulus, in spite of that, firing rate will not reduce much. They are slowly adapting. As an example, as we have discussed, muscle spindle, that is the example of tonic receptor, then nociceptors, baroreceptors, and key. So this is second property. Third property, that is Muller's doctrine of specific. It's also known as label line principle. What is it? As we all know that whenever we are stimulating receptor, what happens? Action potential is generated. This action potential will pass to the brain. Okay. So action potentials are similar in all the nerves. Okay? But why touch receptor when they are stimulated? Then touch. Pain receptors are stimulated with pain. So that is this principle, label line principle. Why? Because there are specific pathways. These pathways, they separate from sense organs to the cortex. Each and every sensation has particular pathway. That is known as specificity of nerve fiber for transmitting only one modality of sensation. Different tracks are there. We will discuss that. Suppose for touch, we have different track. For pain, we have lateral spinothalamic track. So when that particular sensation, particular receptors are stimulated, this pathway gets stimulated and we have the particular sensation. For example, suppose somebody has a compression of the nerve. So the compression, that is the pressure, but the pressure will not produce a sensation of pressure because there is compression, and compression that results in pain. So that is specificity. So Muller's doctrine of specific nerve energy, that is third property of receptor. Fourth one, that is response to increase in the strength of stimulus. Here there is a direct proportionate strength of stimulus and the response. As we are increasing strength of stimulus, the response will be increased. Okay? So this is more commonly related with the intensity. So here you can see, but this relationship is response is directly proportionate to log of strength of stimulus. Means suppose we are increasing strength of stimulus 100 times, then what happens? Response increases 2 times only. Why? Because response is equal to log of strength of stimulus is 100. 100 is equal to 10 raised to 2. So response is equal to 2 log 10. Log 10 is equal to 1. So response becomes double. So this is Weber-Fetch's law. Okay? Next is law of projection. What is this law of projection? You can see here. When any part of the sensory pathway, this is our sensory pathway. When any part of this pathway is stimulated, we feel conscious sensation to the location of receptor. Suppose we are stimulating it here or somewhere. We feel sensation at sensations are referred to the location of receptor. For example, suppose any limb is amputated or some person may lost the limb in accident. So what happens here? Sometimes the person is having feeling of phantom limb. Phantom limb means the person feels that limb is present. And that why? Because whenever this pathway is stimulated, conscious sensations they are referred at the site of receptor. So this is phantom limb. This kind of sensations may be found after removal of breast or tooth extraction also. So these are 5 properties of receptors. Let us revise fast. One, that is specificity of response. Second, that is adaptation. Third, Muller's doctrine of specific nerve energies. Fourth one, that is response to increase in the strength, that is Weber-Fach's law. And fifth, that is law of projection. Now, next thing that may be asked in your receptor question, that is sensory transduction. What is the sensory transduction? Sensory transduction is the phenomena of transfer or transformation of different types of energies, action potential. You can see here, any kind of, as I told you, these are sensory transducers. So they transfer different varieties of energy, action. It has got 3 steps. Number one, that is stimulus comes, arrival of stimulus. Second, that is production of receptor potential. Receptor potential. Or it is also known as generator potential. Third, that is production of action potential. Now, so here, let us discuss one by one. First step, that is arrival of the stimulus, the receptor. Okay? So whenever there is arrival of the stimulus, it is either mechanical stimulus or thermal, that is cold and warmth, or light, or chemicals, or sound. Anyway, stimulus arrives. Okay? Then second thing, that is production of receptor protein. You can see here, whenever there is stimulus, there is whenever the stimulus is applied, what happens? There is change in the membrane potential. You can see here, there is slight depolarization. Okay? And this is known as generator potential. Okay? Most of the time, generator potential, that is polarizing, because here what happens? Sodium ions they enter, and because of entry of positive sodium ions, there is receptor potential. This receptor potential has following properties like EPSP we have discussed, excitatory postsynaptic potential in the synapse and electrical potential in the nerves. Here you can see this doesn't follow all or none law like action potential. Here it is graded potential. Graded means it will be added. Suppose here this is 1 millivolt, then again 1 millivolt, so both are added. It is local response. It will not propagate like action potential. That is second property. And summation is possible, as I told you, and there is no refractory period like action. Third, that is production of action potential. Here what happens? You can see here first there is receptor potential. Receptor potential is generated here at the unmyelinated nerve ending. This is, you can see, at the transducer region. Okay? Then it depolarizes sensory nerve ending. Okay? Now, here, because of depolarization, you can see here positive charges are inside and negative outside. And there is circuit of current. Circuit of current flows from positive to negative side here. So this circuit of current develops, local circuit of develops. Because of that, there is depolarization of first node of Ranvier. When the first node of Ranvier gets depolarized, and when all this depolarization gets summated, and that results in generation of action potential. So for generation of action potential, this first node of Ranvier is important, and for local potentials, this sensory nerve ending is important. Okay? So here you can see action potential then develops. Here this is the structure of Pacinian corpuscle. I will discuss what is Pacinian corpuscle and how it helps in this local potentials and action. So first of all, we will discuss that for this electronic and ionic events, we use Pacinian corpuscle. for the recording of action potential as well as generator or receptor. Why do we use Pacinian corpuscle? Because these corpuscles are large in size, they're easily available in the mesentery, they are easily isolated and they are used for the studies. And its anatomical configuration also it allows to study with the use of microelectrodes placed inside. Now, so here you can see the structure. It has got naked nerve ending. You can see here, naked nerve ending. And there are concentric lamellae of connective tissue here. Okay? This naked nerve ending is having diameter of about 2 micrometers. Okay? And myelin sheath is there. Myelin sheath begins in this concentric nerve and concentric lamellae. So first node of Ranvier is there inside the corpus. Okay? Now, how to record? For recording, you can place one recording electrode on the this naked nerve ending. You can see here, and another on the first node of Ranvier here. And sorry, and this both are connected to RO, that is cathode ray oscilloscope, and by which we can record the potentials. You can see initially there is receptor potential and followed by action potential. Okay? Now, generator potential, as we have discussed, when the stimulus strength is less, mild pressure when we are applying on this concentric lamellae, what happens? There is, you can see, slight change in the membrane potential, depolarization. All these depolarizations are summated. When it reaches to threshold, okay, then there is generation of action. This is the same thing depicted here. This is the receptor potential and action potential. And I told you that receptor potential that is generated at this naked nerve ending. Action potential at first node of Ranvier. Okay. Now, how to prove this? Okay. So, demonstration. Here, as I told you that receptor potential is generated at this ending and action potential is generated at the first node of Ranvier. Okay. Now, so for that, how to prove it? So for that, first of all, we have performed one experiment. We have applied pressure here on this concentric lamellae. We found that we can get this kind of receptor potential and action. Then after that, what we have done is we have removed this concentric lamellae. You can see here, only nerve ending is there. And we have applied pressure directly. Still we found this kind of receptor potential and action potential. So you can say that concentric endings are not needed. If they are absent, then also this receptor and generator potential as well as action potential they develop. Okay. Third experiment, in third way, what we have done is we have blocked this first node of Ranvier. What happened? There is no generation of action potential. You can see. So what is conclusion by this? That action potential is generated at the first node of Ranvier. Then in next experiment, what we have done is we have destroyed the sensory nerve. When the sensory nerve is cut and allowed to degenerate, then what happens? Neither receptor potential nor action potential are generated. So you can say that this naked nerve ending, it is the site for generation of receptor potential, and this first node of Ranvier that is important for action. Okay, so this is all about our today's topic. Now, few questions. Give me 5 minutes and try to answer. If you answer, try to give answer in chat box also. So now, first question: Measles corpuscles. They are believed to be sensitive to. Options are A, pH of interstitial fluid, B, histamine, C, change in the temperature, and D, mechanical deformation. And correct answer, that is D, mechanical deformation. Second question: false statement about Pacinian corpuscle. A, they respond maximum to sustained touch. B, onion in shape and lamination. C, found in large number in skin, subcutaneous tissue and mesentery. And D, solely adapting type of receptor. Obviously, it is as we have discussed. Pacinian corpuscles, they are rapidly adapting type of receptor. This is false statement. Third, false statement about receptor potential. Non-propagated depolarizing potential. To obey all or none law. D. Magnitude is directly proportionate to intensity of stimulus. And D. Resembles EPSP. We have already discussed. Receptor potentials, they are non-propagated, definitely. They do not obey all or none law. Magnitude is directly proportional to intensity stimulus and resembles EPSP. So, false one, that is obey all or none. Then, Weber-Fetcher's law. It deals with frequency discrimination, receptive field organization, intensity discrimination, and 2-point discrimination. The correct answer, that is intensity discrimination. Response directly proportional to log of strength of stimulus. Intensity increases, response increases. Fifth, phantom limb phenomena is described by dash law. That is by law of projection. I think everybody is attentive. Law of projection. Sixth one, phenomena of adaptation is complete and fast in fast rapidly adapting receptors. We have already discussed. Yeah, rapidly adapting receptors are our Pacinian corpuscles. So the answer is A. Then, no matter where a particular sensory pathway is stimulated along its course to the cortex, conscious sensations produced is referred to the location of receptor. This is dash law. We have already discussed law of projection. Source of generator potential in Pacinian corpuscle is generator potential. That is, as I told you, unmyelinated or naked nerve ending. As the strength of stimulus is increased, it spreads over a large area and activating more and more receptors. This is known as specificity of response. Strength increases, more receptors are stimulated. Specificity of response, recruitment of sensory units, or law of projection. Correct answer is recruitment of sensory units. So this is all about today's topic. Thank you. If you like the video, you can like, you can share with your friends, and you can subscribe the channel on Academy Future Doctor.